Okay, so I'm very happy to be here, and I think I'm happy to hear the last presentation because I'm gonna support some of the things that they saw with the parental environment, and I hope that we can keep with the same head. Okay, so I'm gonna talk about our work, parental express emotion, parenting stress, and behavioral problems in children with 22q deletion syndrome and idiopathic autism. I'm gonna first talk a little bit about the syndrome that I work with. It's it's a neurogenetic syndrome caused by the deletion in chromosome 22q in 22. I will say 22q instead of all the name because it's really really long. So it occurs in one out of 4,000 live births, and it has a lot of medical complications, cardiac malformations, palate malformation, immune problems in the immune system, and also have developmental delays, and the average IQ is in the borderline range. And so why am I talking about it? Like, we are in Congress of Autism. It's because they have a really really high percentage of psychiatric disorders, including ADHD, anxiety, mood disorders, and iASD. And another thing that is also very important about this syndrome, that around 30% of patients develop schizophrenia, spectrum disorders by early adulthood. So it's like a model for us to understand the psychiatric disorders. Okay, so we made a study about children with 22q in early childhood, and we found that even at those ages, there are really, really high percentage of psychiatric disorders. And as you can see, ADHD, anxiety disorders, elimination disorders, they were like the most prevalent. And in our sample, we found that 16% of children were diagnosed with autism. And when we compare the groups with 22q and the group with idiopathic autism, we found that the symptoms of autism were less severe in 22q, and they had higher repetitive symptoms, but I'm not gonna go into this because we're gonna talk about the next research. So when we study genetic syndromes, sometimes we forget about the environment, and this is the theme of our research. And we thought that we need to also look for the family environment and the association with the genetic problems with these kids. Okay, I'm gonna talk about some factors of a family environment. The first is express emotion. It's the caregiver's attitude towards a person with a psychiatric disorder. There are thoughts, feelings about this patient, and it first was studying schizophrenia. I think all the psychiatrists study about it in the exams, and studies have found that it's a predictor of relapse in psychiatric disorders. And also there are some recent studies that they found that it's also predicts relapse in some medical disorders like diabetes. They found that the families with a high express emotion, they have less glycemic control. So it's something that we need to think. And there are many factors inside the express emotion. I'm gonna be talking about two. The one is criticism, and the other is emotional over-involvement. Criticism, as you can imagine, is all the negative comments, all the negative thoughts and feelings about the patient. And emotional over-involvement is all the feelings of self-sacrifice, over-concern, that is like a weight, that this patient is a weight for me in my life. Research about the express emotion shows that mothers of children with psychiatric disorders, they have a higher express emotion, that is a high criticism, high emotional over-involvement, and the higher the criticism, the higher the behavioral problems. In autism, there are many many studies, but there's only some studies in children so young. And there's no information about the express emotion in 22q until now. And the other factor that we're studying is parenting stress, and it's a psychological stress that comes from the demand of being a parent, and also all the like lack of support, all the stressful things that happen around. And there are a lot of research of parenting stress, also in 22q and also in idiopathic autism and autism, and we found it's high in these populations, and it's associated with children's behavioral problems. Okay, so our work. So we took 74 children, ages 3 to 8, and we have 3 groups, one group with 22q, one group with idiopathic autism, and one control group, typically developing. And we examine also the children behavioral problems with the CBCL and the family environment. With parenting stress index, that is the parenting stress, and express emotion, we examine with a procedure that is called a 5-minute speech sample. So I'm going to talk about it a little bit now. Okay, so in this procedure, you ask for the parent for 5 minutes to talk about his child and about his relationship with him. So what is very, very good about this measure is that they don't know what you are measuring. So there's less bias. So you just tell them, just talk about your children. They just, everything that goes in their mind, they just get it out. And then we code it, and then we take information about this procedure. And I'm gonna show there are some examples about criticism or emotional over involvement. Being with my kid outside the house is just a nightmare. If you have ever heard about sacrificing everything in your life for a kid, this is it. No matter how hard I try, she never listens to me and does whatever she wants. I was so frightened for her to get sick again that I just prefer to stay in the hospital and stop my life. I just remind you that these kids with the syndrome, there are kids that are a lot in hospitals. So it's really, really a difficult stage all these at this young age. There are also a lot of surgeries, so it's really, really hard for the parents. Okay, so what we find. When we compared criticism in the 3 groups, we found that in the 2 clinical groups, there was higher criticism compared to the typical developing group. As you see, there was no criticism in that group. And also the behavioral problems, they were higher in the clinical groups than in the control group. Okay, and there were all the factors were correlated. Also the parenting stress, also express emotion, and also behavioral problems. And when we separate each one, we found that parenting stress predicted higher children externalizing and total behavioral problems after controlling for age and income. I just want to say that income was also correlated. That is also something that I heard in the last presentation, that income was also correlated with behavioral problems and with parenting stress. But we control it, and even though there was a prediction of more problematic behaviors, all these results were consistent across all groups. That is also an interesting finding. When we took express emotion, we also found that it predicted internalizing, externalizing total behavioral problems after controlling also parenting stress. I would say that this may not that is not taken for granted, because also parenting stress was really, really high and was really, really correlated. So even though controlling it, it was also it also predicted the behavior. And when we check every part every part of the express emotion, we found that emotional over-involvement predicted externalizing and total behavioral problems, controlling also parenting stress. I'm going to say that emotional over-involvement is a more controversial theme in express emotion. There are some research on some studies that they think that is not related to behavioral problems, but in our research we found that it's also important. Okay, so the conclusions. So we think that parental environment is a really, really important factor that we need to check, and we need to don't forget it, even in genetic syndromes. It should be, we think that EE, like express emotion, should be included in the assessment of young children. And we think that also the two things that are the two parts of express emotion, also emotional over-involvement and also also criticism, should be included. And we think that express emotion may be a target for treatment. There are already research that found that treatments that are targeting express emotion they have a superior outcome that the treatments that don't have it. So it's like we have here some clinical information that can help us to reduce behavioral problems in children also with autism and also with 22q. And we think that more research is needed, especially longitudinal, so we can prove our findings. And I want to thank my team. Also Cory was here, and Professor Fratscher that it really, really helped me in express emotion, and Doron Gottels, my mentor.